Oh, hey. I have a story, okay? The last few days, I've been in the ER 2 times. There's 2 parts to the story, and one of them is it's just an interesting perspective. So I'll probably make 2 videos. This first one is what I've been going to the ER for, and it's not for my Alzheimer's, which is great. And the reason I'm even putting this up here is because I'm like, maybe somebody else has dealt with this before. Okay. So 3.5 weeks ago, prior to me going on my vacation, I had a really bad back pain just in this one spot, which is whatever. I have a really bad back. So I'm like, oh, yeah, it's back pain. No big deal. But it was very localized and it hurt when I took a breath. That was the difference of any sort of musculoskeletal injury I've ever had before, which I've had lots. So at first I just thought it was muscle. And I had a massage and my massage therapist was like, I don't feel any muscle tension there. Cool. Okay. Then I go on the vacation and it's really hurting. And Vanessa's like, it's probably your rib. I was like, oh, that's probably it. I've never had a rib issue, but that made sense to me. So I'm like, oh yeah, that's probably what it is. When we back, and I don't know if you can hear my voice, but my voice is changing. When I got back, like a week and a half, if not a little bit longer now, the pain moved to my side of my chest, and it's always when I take a deep breath. I have sort of like a consistent baseline pain, like all the time, but when I take a deep breath, I get a sharp shooting pain. So I'm just like not doing anything about it, right? I'm just like, it's going to go away because it's a rib. So I'm just living my best life in denial, right? And then on Friday, it moved to the front. Okay, moved to the front of my chest on my left side. No, I didn't think it had anything to do with my heart, but I was like, hey, this is weird. Because you think when you take a deep breath, that's your lung. So I was like, I don't think it's a rib. I think it's my lung. And so I go there. It's insane. It was Friday night, so it was packed. But I go in, get my blood work. Of course, I can see it on my health portal, so I can see that my blood work came back fine, which is great. And then they did an X-ray. So at hour 6, I left. I'm like, no, I'm leaving. So I left. I came home. And I thought, well, what I'll do is wait the 3 or 4 days for the X-ray results to come up on my health portal, and I'll just see if they saw anything, right? So that was Friday. Came home. Saturday, it hurt really bad. It started to hurt really bad. Like the pain was increasing. Sunday was really increasing to the point that every time I got up, I would have to walk kind of bent over a little bit because I couldn't take a deep breath, and I just couldn't take a deep breath at all. So I was doing a lot of shallow breathing, right? Anyways, I decide at midnight I'm going to go to the hospital. I'm going to the ER. Just took my ass there. It was me and 2 other people. I was like, this has never happened before. It was actually such a good experience. The nurses were hilarious and so fun. I got a room, which was beautiful. I got in right away. Essentially, the doctor came in and he's like, well, we need to rule out a pulmonary embolism. Fair enough. That makes sense. But he's like, it could be pericarditis, which is inflammation around like your heart, right? I'm like, okay, cool. So he sends me for a CT. And here's the funny thing, okay? So he's like, I don't know if I should send you for a CT because, radiation in the long run, that's not good for you. And I was like, oh, well, I have young onset Alzheimer's, so I'm not going to be around for 10 or 20 years. And he's like, oh, I'm so sorry. He's like, okay, let's get you a CT. So we go for the CT, come back. And then it's shift change. So I get a different doctor, which I hate because continuity of care, yes, they charge off and they give whatever, but you've built a rapport with the one doctor. So I kind of was hoping to get him. But anyways, I got a new doctor. He came in and he's like, no, your CT looks great. I agree with the other doctor. I think it's probably pericarditis. Here's some anti-inflammatories with like whatever. So it gave me some meds to go home, and I was like, oh, good. I just want to make sure it was my lung, right? Because when you take a deep breath and you get sharp shooting pain for over 3 weeks, like you think it's your lung. And he's like, oh, well, they did find a nodule on your lung. It's common though, so not to worry, but it does require a follow-up. So he wasn't even going to tell me. Okay. Wasn't going to tell me. I was like, oh, cool. And then he was almost talking to me as if I was going to have anxiety around it. So when I'm in those places where I'm trying to prove to a doctor that I'm not going to be anxious about it, I put on my performance. And I'm like, oh, so you're telling me not to fearmonger? Oh, I'm not going to fearmonger. Don't worry. Like, I just don't want to be perceived that way. I'm like, you can tell me real news. I just got a fucking terminal diagnosis. I can receive real news, right? And if you're saying it's a nodule and it's normal, that's fine. Cool. But we joked a little bit about it. Ironically, he's like, I want you to double up your GERD medication, which is the one that not causes dementia, but it's a risk factor to dementia. So I didn't say anything to him because he didn't know I had young onset. I hadn't told him. Anyways, long story. So I come home and I'm like, okay, so they're there to make sure that I'm not going to die that night. That's what their job is. They don't care about long-term blah, 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 blah. But I got home and I was like, I understand the nodule. And from my understanding of like looking things up, it looks like they're quite normal and they are found usually by accident, which makes sense to me. So if I'm going there and they're looking for my rib and then they find a nodule on my lung, that makes sense to me that you would just find it incidentally, right? But if you're going there with a hard time breathing and you find it, wouldn't that be not incidentally? Wouldn't that be that they found a nodule in my lung that needs to be followed up to make sure it doesn't grow and become malignant? So to me, that's where I'm like, oh, okay, so yeah, did you find it by chance or did you find it because I'm having a hard time breathing? And now my voice is quite horsey and it's affecting me quite heavily, to be honest. I did have a cousin uncle who died at 45 from lung cancer. Not that, like, I'm not worried about that, but it's like, the reason I'm putting this out there is, yeah, there's 3 kinds of nodules, like in shapes and sizes and stuff. And like if it's under a certain amount of centimeters, they don't follow up. But if it's in this certain range, that you need a follow-up CT in 6 to 12 months to make sure that it's not growing and turning into a malignant mass or whatever. And so I'm in that 6 to 12 month follow-up period. So it's just confusing to me. I'm like, are these symptoms from that? Do you know what I'm saying? I mean, it's not the end of the world because I already have a terminal diagnosis. So it's not like, it's not going to change anything. But I think what my concern is I don't want to do any more testing. Like, I don't want to spend the last years of my life or months or however long I have going in for more MRIs and CTs, and I have a doctor's appointment. So obviously we'll look into it a lot more than an ER doctor would, who basically is just telling me I'm not going to die tonight, which is great. I never thought I was, but anywho, yeah. So if anyone has had a nodule in their lung, I know I'm not worried about it. I wouldn't be worried about it if I didn't have symptoms. The only concern I have is that I have symptoms. So if I didn't have a hard time taking a breath and now I'm getting a horsey voice, then I wouldn't be concerned. And am I that concerned? No, I'm not. But it's weird. It's just weird. I have another story to tell about the ER, and I will tell that in 2 minutes.